Austin is the capital of Texas and the 11th most populous city in the U.S. Located in the central part of the state, it is known for its warm summers, South by Southwest, and being home to the University of Texas, which over 50,000 students attend. The city's official slogan is the live music capital of the world, referencing the city's large number of musicians and live music venues. The population in Austin has been steadily growing for several years. It was recently reported that Austin has been the most popular place to move in the U.S. during the pandemic. With this population growth, there has also been rising housing prices, and rent continues to outpace renters' income. Homelessness has long been an issue in Austin. There are many encampments throughout the city, and just spending a few minutes in a car or by foot, you can spy a gathering of tents or personal belongings under an overpass or on the grassy side of a street. In January 2020, a point-in-time count found 2,506 individuals experiencing homelessness in Austin. This is a 10-year high. There are numerous different factors that lead to homelessness. These can be structural factors such as poverty, unemployment, discrimination, incarceration, high housing costs, as well as personal factors such as substance use, mental illness, and traumatic life experiences. Whatever the reason may be, and usually it's more than one factor, there is one thing all these individuals have in common, and it's that they don't have a safe place to call home. Housing is a fundamental human right and a crucial determinant of health, leading to great health disparities among individuals experiencing homelessness. Being homeless is associated with shorter life expectancy, poor control of manageable conditions, and greater usage of hospital services. Lack of shelter, exposure to violence, low-quality sleep, all of these things contribute to the toll that chronic stress has on the body and the multiple adverse health outcomes associated with it. There are also many health system barriers in place for homeless individuals. Many do not have a usual source of care. They may lack health insurance. They may have higher priorities than seeing a healthcare provider, or they may not feel welcomed or safe in traditional healthcare settings. I spoke with Catherine Lentz, a registered nurse in Austin, who has worked with individuals experiencing homelessness for several years in both hospital and clinic settings. I asked her what she thought were some of the issues that can come along with homelessness when someone is accessing healthcare.
Patients are not able to utilize telemedicine. They don't have the technology, but they also can't necessarily afford transportation, even a bus pass to get to and from the clinic. It can be difficult for them to obtain needed lab work to monitor their condition closely, difficulty affording medication. They have had to leave in the middle of treatment because their campsite was being, I believe this individual was notified that his belongings and tent were being stolen, and even though he was very, very sick and definitely shouldn't have left the hospital, he left against medical advice.
Some other issues we discussed included patients having issues keeping medication safe, or being told to follow specific diets but then having trouble doing so without access to healthy foods or a kitchen to prepare meals in. We also discussed issues with communication and then losing patients to follow-up, and we spoke about how people experiencing homelessness utilize emergency rooms for medical needs.
The homeless community will have to resort to using an emergency room or emergency facilities in order to just get basic medical care. And a lot of times, because they don't have that readily available doctor or advanced practice provider that can just manage chronic conditions, things wait and sit until it becomes an emergency.
I went to speak with some individuals experiencing homelessness in Austin. I purchased grocery store gift cards in exchange for their time and headed to Cesar Chavez Street and found that many people were eager to speak with me and tell me their stories. Some names have been changed for these interviews. First, I spoke with Rick, who is originally from Austin but has lived all over the U.S. He rated his health as fair and said that he struggles with several health issues and utilizes the hospital for his healthcare needs. He recently went to the emergency room for a COVID test and ended up needing a blood transfusion. He was referred to a gastroenterologist when discharged from the hospital.
When I got my blood transfusion, they recommended to a doctor for my gas and my gasologist, but they didn't want to take what I carry as a MAP card, and they wanted a Medicaid card. And I said, why did they send me to this doctor? And he won't even receive what credentials I have.
He never ended up seeing the specialist. He did tell me that he utilizes meal services at churches downtown for most of his food. He was excited about the meal he was provided most recently.
Saturday's breakfast is usually just a ham sandwich, right?
Okay.
Today was more of a turkey dinner.
Okay,
So
nice.
I think it's because of the holidays, the type of food that was given out was extraordinary. I found it odd, you know.
Yeah.
Rick showed me how he had
Oatmeal
decorated
and-
his tent for Christmas with stuffed animals and some lights. He is hoping to get a room at a hotel provided by a city agency soon. Next, I spoke with Gary from Laredo, Texas. He had wanted to join the Marines when he was younger, but made some mistakes in life and was unable to do so. He rated his health as okay and said he utilizes the emergency room for health services. Most of our conversation, he was talking to me about how he really wants a job. He's hopeful to get something doing physical work because that's what he really likes to do.
I'm not here trying to get anything from anybody or get anything. They're trying to always give me money over here, money over there. No, I don't want that. I want a job.
Gary showed me a spider bite that he had on his leg, which became infected, but he did not seek medical treatment until his leg was very swollen. He then went to the emergency room and then had to be admitted for IV antibiotics. He has since been discharged and showed me his wound care supplies the hospital gave him that he keeps in his backpack so that way it's safe. He did tell me that he had been unable to fill his antibiotics prescription, but thought that the spider bite was getting much better. Gary's also a talented artist. He showed me his sketches and said he used to do tattoo work. He's hoping to see his daughter soon, but said that she lives very far away. Next, I spoke with Ron, a veteran from Shreveport, Louisiana. Ron came to Austin hoping to be part of a friend's ministry program, but that didn't work out. He has been living on the streets since 1984. He said he gets his medications and sees doctors through the VA, but sometimes has issues making appointments or picking up blood pressure medications due to transportation. He told me about friends that have committed suicide while experiencing homelessness because of the mental toll it has on a person.
You know, just finding somebody that do care to help you get out of this predicament.
I spoke with several others, many sharing similar things, that the biggest help would be a home, that it's hard to access resources without a mailing address or a ride, and that evictions are a big issue. I asked Catherine what she thought would help this community the most.
Access to transportation, if there was like a case manager or social worker that was, heavily involved, with helping patients get to their doctor's appointments and get the medical care they need.
Austin has many resources in place for people experiencing homelessness. The City Council recently voted on December 3rd for their first ever housing vouchers, which will help 170 people escape homelessness and obtain housing. Despite these resources, there are still many people needing homes. Back in June 2019, Austin lifted a ban that previously was making it a crime to camp in public. This received backlash from several community members and even the governor of Texas, who saw this revision as a public safety issue. However, a city cannot punish people for sleeping outdoors when we do not have enough room in shelters or housing opportunities. Poverty should never be criminalized, yet you'll see signs throughout the city that say ban camping. In order to see real changes, people need low-cost housing and living wage jobs. A housing-first model needs to be the focus. This provides housing without any barriers and also provides support services like access to employment or career help. For individuals recently exiting the prison system, they need a transition program that provides rapid rehousing and support while they navigate life out of prison. A coordination director could assist the city in connecting services, especially between emergency departments and the local clinic networks. There also need to be more housing and security protections, preventing illegal evictions and holding landlords accountable. These interventions will bring individuals closer to having a place to call home and improving their potential to live a healthier life. Addressing homelessness is a form of health care. It's important to note that Austin has racial disparities among people experiencing homelessness. African Americans represent more than 1 in 3 homeless individuals counted this year, even though they represent less than 1 in 10 individuals in the Austin area. A racial equity task force was recently created to try to ensure equity and access to housing opportunities. Research at Columbia University predicts that there will be a 45% jump in homelessness by the end of 2020 due to the COVID-19 pandemic. It's time to work harder than ever to protect individuals from a situation that will drastically affect their health. Every human being deserves the right to a healthy life. Without a home, an individual experiences health disparities that those with a home do not, making it a major public health issue. Along the lake at Auditorium Shores, there's a memorial for those who have died while homeless. In 2020, there have been 256 individuals experiencing homelessness that have passed away. A live oak tree has dog tags inscribed with the names of each individual. If a name wasn't known, they put friend on the tag. Many of these deaths are related to health disparities that come from not having access to a safe home. I'd like to thank everyone who participated in this video. It seems that the unhoused are always spoken about, but since they are the experts and have lived experiences, it's important to listen to them so we can move forward as a community and address homelessness and eliminate this health disparity.